Well, hello again, everyone. My name is Marty Guthmiller, CEO at Orange City Area Health System, bringing you today the 60th edition of our COVID-19 community briefing. It is October 2nd, 2020. You can probably see on the screen, it's a little different format for today, but we're very pleased to welcome Dr. Alan Laird with us this morning. Dr. Laird is our Chief Medical Officer, and Dr. Laird will be addressing some questions actually that we have received from some folks out in the community, and we'll be going through those in just a little bit. October is here. Believe it or not, we're still talking about COVID and will be for some time. The president has tested positive for COVID overnight. 2020 keeps on providing twists, seemingly at every turn. And so, if anything, we're consistent so far in 2020. We'd just like it to be a little bit more positive consistency at this point. We're going to jump right into some of the statistics for today, and then we'll get on to the questions and maybe a couple other topics as well. Again, we're pulling all of this information from the coronavirus.iowa.gov website. You're free to do a couple things. First, verify all the numbers that we provide for you. They're there, that's where we're getting them from. And also go there on your own in between briefings and stay up to date with all the information that's there. Again, coronavirus.iowa.gov. Since today is not a Monday or the first briefing of the week, we will be talking first of all about Sioux County. Sioux County, as of today, has 1,796 positives. That is 127 more than Monday's numbers reported. The 1,796 is a percentage of 8,064 tested, and that percentage is 22.3%. Just as a comparison, the numbers prior to that were at 21.6, 21.2, and 19.8. So no question, we continue to climb in the positivity rate in Sioux County. 14-day positive average that we've been discussing all along, Sioux County is number 2 at 27.7%. Now that number is still way too high, still a very high number, but it is down from 29.6 the time before when we've talked, and 31.2% the time before that. So we are dropping a little bit, again, still too high, but it's moving in the right direction. Lyon County has assumed the number 1 position at this point at 30.8%. They did jump from 27.5. Northwest Iowa counties are dropping a little bit in terms of the top 10. O'Brien County, number 5 at 18.6. Osceola County was previously 4. They are now number 8 at 17.8%, dropping significantly from 27% just 2 times ago. Plymouth County is out of the top 10 at number 11, and they were previously number 6. So Plymouth County has dropped to 15.7%. Still a number 15 and above is a number people get a little concerned about, but Plymouth County is getting there. There are 34 counties in the state at a 10% or higher rate. And that number when we spoke last was 31. So there's a lot of this stuff out there, folks, and it continues. Moving on to hospitalizations, Region 3, the 20 counties in Northwest Iowa, we have 97 hospitalizations in those 20 counties currently. That number when we spoke last was 96. So basically it stayed the same. We have 18 people in the ICUs in these 20 hospitals or 20 counties, and 9 of those 18 ICU patients are COVID ventilator patients. The 18 ICU number was 22 the last time we spoke. And there have been 14 patients admitted in the last 24 hours. Still, in terms of availability, plenty of beds and plenty of ventilators in the area readily available should they be needed. Iowa, 90,687. It will not be long before we hit the 100,000 mark in the state, and it will not be long when we hit the million test number as well. There are a number of tests, and we'll have more information on this next week, but a number of tests that are flooding into the state that we're going to make testing much more readily available and much sooner as well. And that information will be coming out as early as Monday, but there'll be good news on that front. 11.2% positivity rate in the state of Iowa. And that number is climbing, is 11.1 and 11.0 respectively the last couple times we talked. Hospitalizations, not good numbers in terms of the people being hospitalized. And unfortunately, when I checked this morning, the website, coronavirus.iowa.gov, the hospitalizations numbers were updated as of 9/29. So that's a few days ago. At 3:24 p.m. So it's you always have to look and look when that data is stamped from a time standpoint. So this was the data, and I'll give you a little bit of update on that, on where we stand currently as of about 15 minutes ago. Iowa has 361 hospitalizations as last reported. That number previously was 315, and the time before that 276. So from about a week ago, we're up about 100 patients in the state, 100 hospitalizations in the state of Iowa, roughly. Sioux County, as of 9/29, had 23 hospitalizations in terms of residents of Sioux County being hospitalized somewhere. That number previously was 21. O'Brien County, 6. Number previously was 5. Woodbury County, 34. That number previously was 23. Plymouth County, 9, and that number previously was 8. And Lyon County is 0, and they had 1 previously. Polk County is 34, and their number previously was 34. So this is spreading out. It's all over our state, and those numbers certainly reflect that. The final statistic that we have are the ultimate acuity measure, and that is deaths. And unfortunately, we've had 50 additional deaths since Monday. The number is at 1,367. Sioux County is officially at 4 deaths at this point, up from 3. And you know, it's been inevitable given the demographic of the folks that we know have COVID, and that other hospitals have been sharing with us in terms of their demographics, and it's very unfortunate. And I would just add at this point that, maybe this is a little sharp, but I want to make sure that people understand that, because there are those of you out there that think that this is a hoax, and there are 50 more families this week that you might want to talk to about that, on whether this is a hoax or not. Because it is not. People continue to die. People continue to get sick. Now, we have to keep that in perspective in terms of the demographic and how that occurs and all that. But this is not a hoax. This is very real. I'm going to turn now to Dr. Laird. One of the things that we appreciate at the health system is when we get questions from our patients that maybe could help other people ultimately deal with things as we go along on this everlasting COVID journey. And the question these series of questions, and there are 5 of them, basically talk about what do people who have tested positive, how do they deal with this moving forward? Can they be of a help to others? You know, all those questions. So we're just going to jump right into this. And so Dr. Laird, welcome again. Appreciate the fact, always good to have you with us. Appreciate that greatly.
Thank you for being here with me today, Marty. Thank you for inviting me.
You bet. And Dr. Laird is joining us today from the campus of Northwestern College, where Dr. Laird is playing a significant role in the new physician assistant program there, and the college and students are lucky to have him. So, so we're glad you're with us. Now, time to go to work.
Okay.
All right.
Fair enough.
Here's the first question. As a recovered COVID person, can we get COVID again after having been tested positive?
Great question. The honest answer is we do not know for sure. There have been reported cases of people getting it a second time in a short window. We believe that is not the average, that most people will have a significant period of time for immunity. We do not know if that means lifelong. We're not sure if it means several months or if it means years. If it behaves like other coronaviruses, then probably 2 to 3 years you have immunity, but would become susceptible over time again. But no one knows with this specific coronavirus all of those answers. And so that's something that continues to have more data flushed out about it. But at least for the short term, we would expect that you'll have immunity and not be able to get it again.
Okay, thanks. Question number 2, should we be tested to see if we have antibodies that would benefit others who are experiencing COVID? So this would be a positive patient. Should we be tested to see if we have antibodies that would benefit others who are experiencing COVID?
Again, thank you for the question. I would say it depends on what you want to do with those. If you're considering donating plasma, which is a wonderful ministry, then definitely I would encourage you to do that. And my understanding is LifeServe in Sioux City is our closest area, although I'm sure Sioux Falls is taking donations. And either you could be tested at your local clinic, because I believe most of the area offices are offering that, or I am sure at those local areas where you donate blood, they would be happy to run antibodies as well. And then if you're choosing to donate serum, that would be very beneficial. We are using what we call convalescent serum, meaning serum from those folks that have recovered from COVID for our patients, and I know other hospitals are as well. So if you're going to move forward with that, I think that's a great benefit and would encourage you to do so.
Okay, thanks. So as a recovered COVID positive patient, do we need to be tested a second time to confirm we are now negative?
Again, thank you for the question. Excellent question. Initially, when this began, which seems like years ago, but probably right around 10 months' time, the CDC talked about having 2 negative tests to prove that you no longer had COVID. As we tried to institute that, we found that people were staying positive for a test, which I want to differentiate. You can be positive for a test, but not necessarily infective to others. That you would be positive for a test possibly for months, because the test is so sensitive, it picks up remnants that aren't even necessarily the full virus and multiplies those so we can find them, and then you test positive. So the CDC has really backed away from that repeat positive testing or repeat negative testing to prove that you no longer have the disease. And they would highly recommend, and I believe that it's a reasonable course, to look at symptom-based monitoring, 10 days from the onset of your symptoms, lack of fever for 24 hours, and in general, symptoms improving. Symptoms may not be completely resolved, but in general, improving. So that really has been our course of action now for proving that someone is over COVID and no longer infective, as opposed to the test, which may remain positive for several months.
Good, thanks. Since we have already recovered from COVID, what is the benefit to continue to wear a mask?
Another great question. And yes, if indeed we make the assumption that you're not going to get it again in the short term and maybe longer, one could argue, well, I can't give it to anybody, I can't receive it, do I still need to mask up? I would say right now, the difficulty will be is how often you wish to explain why you're not wearing a mask if everyone around you is masked. And that it may be easier just to wear the mask, to encourage others to wear the mask. I realize we all have different feelings on this, so I'm not trying to push anything on anybody, but it may be easier to encourage those who haven't had it to wear a mask and to, if you will, feel their pain of wearing a mask by continuing to do so. But otherwise, you may have to wear something that says, hi, I've had COVID. I'm not infective. I can't get it from you. I can't give it to you. And so it kind of depends on where you are socially and who you're with and who knows that you've had it and who you choose to disclose it to. But potentially, if you have had it, you may well be immune and therefore masking wouldn't benefit you, but it might encourage others to continue to mask if you do so.
Perfect. Thank you. Well, we certainly encourage folks now to get the flu shot for this fall, because now we're going into another weird element of 2020, and that is the combination of flu and COVID. So far, we've been dealing primarily with COVID-19. Now we get to entertain the additional fun of flu on top of that. And so this question came from somebody who understands that and heard that message that we are recommending the flu shot, but asking whether or not there is any timing or any coordination between once we've recovered from COVID and when we get the flu vaccine. Should there be any correlation of those two?
Great question again. Let me reiterate what you said, Marty, in terms of getting the flu shot. Please don't forget the flu is deadly too. And we lose people to that every year. We're just used to it, so it doesn't make the news and we don't hear about it every day. So please do consider getting your flu shot. In general, we recommend the flu shot really for most anybody at any time. The one time we would say is not to get a flu shot is if you have a fever. Then we're worried that maybe your immune system won't respond to the virus as well and you won't get all the immunity. So certainly if you're having a fever or significantly ill, I'm bothered with allergies this time of year. If I have a sniffly nose, that should not prevent me from getting a flu shot. So if you have very mild symptoms, you certainly can go ahead and have a flu vaccine. But if you've recently had COVID and maybe aren't feeling 100% over it, or you're still having fevers, then definitely postpone until you're back on the mend, feeling more like yourself, so that your immune system pays attention to the flu shot and not to the remaining COVID, and you get the full benefit of that flu shot.
Good, thank you. So basically, in summary, if you're feeling well, go ahead and get the flu shot.
Absolutely.
Okay, I'm going to move on to another element, because I know that there are folks out there who are concerned about the fact that they know of people who have tested positive or certainly are showing the symptoms, you know, that they have a friend who's tired, lost the sensation of taste and smell, you know, and things like that. But they're concerned that those numbers aren't being reflected in our testing numbers. And I want to alleviate a little bit of that concern and maybe actually shine some hope on this subject a little bit. And whenever you take an extrapolation of a group of numbers, you are taking a little bit of risk. And you have to estimate, you have to generally stay in the ballpark, and not take too literally any kind of conversion. But estimating the number of folks already infected in Sioux County is something of interest to all of us. Now, there are a number of multipliers out there that go up to perhaps as high as 20. So that, you know, for every positive person, there's 20 people that are positive. That's on the higher number probably. A more conservative number would be a multiplier of 10. And if you were to do that, you'd have 1,796 positives in Sioux County, multiply that times 10, you get to nearly 18,000. Now, before you do that, you have to realize that some of those 1,796 folks have been retested. In other words, so we're counting those folks twice. So let's take a smaller number than that. Take whatever number you want. So say, okay, well, I'm just going to say 1,000. All right, so I think the number is higher than that, but let's just say 1,000. If we say there are 1,000 singular infections that have been documented but positive, there's probably easily 10,000 people in our county that are infected and are carrying the virus or are carrying immunity, perhaps. That is a good thing. We want people to be okay with that, because those people, because they are not in our statistics, are not a statistic. They are not sick enough to come into the doctor. They are not sick enough to be hospitalized, but yet they know they had it. That is okay. I've seen comments where people seem to be a little bit nervous and worried about that. I would not be. I would be and am pleased with that. And so I would say on the low end, if you take the 1,000 times 10, you're at 10,000. And if you take 1,500, you're at 15,000. When you look at our population in the county, somewhere in the 35 range, you can do the math and get a percentage of who's positive or not. And so that's a good thing. We're going to expand the testing. Expanding the testing is only going to identify more of those positive. That is not a bad thing. Because again, the majority of people are either asymptomatic or have very mild symptoms, and that's kind of how life happens. That's how viruses work. And I don't know, Dr. Laird, if you have any comment or corollary to this argument.
No, I would certainly agree with that, particularly the more people that could have mild cases and we get through to where those people are no longer at risk and hopefully, as we believe, protected, then there's less for the virus to circulate among us. There's less people that it can get a hold of and infect and reproduce itself. And so then you begin to see the amount tail off. And there kind of seems to be that tipping point where we finally hit a point where the virus really can't find somebody else around it to go to, and things really drop off fairly precipitously. So not that we ever wish anybody to be sick, we do not. But it is nice to see, hopefully, that we can have milder cases and that people can get through this and get the immunity that can be offered right now, which can only be gained by getting the virus. So that we can see this virus move out of our community and not be able to circulate here anymore. We see this all the time with influenza. So it is common that we don't see every case, but we do use a multiplier based upon how many have tested and hospitalizations at guessing what the severity of the flu is. So this is very common in those who monitor the health of populations. To look at that and suspect that even maybe the majority of people are not going to be tested, but we can extrapolate that to the general population.
Good, thank you. So as we move into next week, please remember we have the Test Iowa site. So in our occupational health area, that's a walk-in clinic, not to be confused with our walk-in clinic. This is a Test Iowa site. It's at the west end of our campus, the physical therapy occupational health entrance from 7 a.m. to 9 a.m. Go to testiowa.com, get your QR code, and come and present. That's first come, first serve, 7 to 9, Monday through Friday, testing, and that's free to anyone that wants to be tested. Again, a reminder, we've talked about flu shots, but flu shots, get them, strongly encouraging that, and get them at this point. Clearly, without question, we're in community spread at this point, and this is a broken record kind of thing. But remember, wear your mask, keep your social distancing in place whenever possible, avoid large groups, practice hand hygiene. both in terms of washing and hand disinfectant. Do that, folks. We ask you to help that. Throughout the county, we're having some folks who are being sick, who are workers in our healthcare institutions. We need all of those folks at all of our hospitals, at all of our nursing homes. And so we ask you to help keep them healthy by practicing these measures that we're all way too familiar with at this point. So I'd like to thank Dr. Laird for joining us today. It's always a pleasure and a treat, so thank you very much. And as we go into the weekend, enjoy yourselves. Get outdoors, spend as much time outside as you can, social distance and mask when you can't, do all those things. But stay strong through all of this. Continue to stay vigilant. We can't emphasize that enough. Stay vigilant, and above all else, stay healthy. So have a great weekend. Thanks again, Dr. Laird, and take care, everyone. Thank you.
Thank you.